Hi, I'm Leon Taryan with the Power of the Patient Project. Today, my guest is Dr. Rosamond Rhodes. Dr. Rhodes has taught medical education at different universities, including Clarkson University, Loyola University of Chicago, CUNY Graduate Center, and Union Graduate College. In her book, The Trusted Doctor, Medical Ethics and Professionalism, she discusses her thoughts and the thoughts of other doctors on the value of professionalism and its impact on building trust with their patients. Welcome, Dr. Rhodes.
Good to meet you, Leon.
My first question for you is, in particular, what do you see lacking today between physicians and patients on a professional level?
Usually patients like their doctors, and the doctors I know are very committed to their patients. I could ask you, do you think you have a good doctor? You like your doctor?
Yeah, I like my doctor.
That's what most people think, and they actually do trust their doctors tremendously. And that's what makes the doctor-patient relationship work.
Do you see anything lacking today with that relationship, or do you think that's mostly a very positive mutual relationship between the patient and the provider?
There are always outliers, but for the most part, I think it's extremely positive. Doctors choose, for the most part, this kind of profession because they want to help people and they care. So for the most part, it goes really well. One of the big problems I see is time. Doctors are asked to see many patients in a short amount of time, which means each patient gets probably something less than they might want, or they have to wait a long time for an appointment, or they have to wait for their current appointment. So time issues are a problem.
And in terms of trust, in what ways could doctors build that trust with their patients?
I think there are a number of elements that are really important. One, doctors have to listen to what their patients are saying. When they ask questions, they have to pay attention and listen. And this gets a little tricky because doctors are often, at the same time they're asking questions, they're writing things on their computers. And that interviewing the patient and writing on the computer simultaneously is a skill, and a lot of good doctors have really mastered it, but it can be dicey. And some patients get kind of offended when they see their doctor writing on the computer instead of looking at them in the face. So I think one way is build a patient, listen to them, looking at them in the eye, letting them know that you genuinely care about them. Another key element is telling them the truth always, even when it's bad news. The patient has to be able to trust that you're being honest with them. Another important thing is paying attention to the patient. So if the patient, you get a sense that the patient hasn't quite understood, try to say things again in a gentle way that encourages them to understand and ask questions. So that gets a little bit dicey because patients also need to feel respected by their doctor, and not as if they're being judged for their decisions. Even if it's a decision not to get the vaccine, you have to feel that your doctor cares about you and cares for you to make this relationship work. And when the doctor has to also at the same time evaluate whether you're understanding, that leaps over into the realm of paternalism. And at its core, medicine is a paternalistic profession. You have the physician has a fiduciary relationship with the patient. The physician is committed to acting for the patient's good. And part of that involves assessing whether the patient has decisional capacity and therefore should be respected completely, or whether decisional capacity is impaired. And you can think about a number of features in medicine that can impair decisional capacity. A patient hears bad news that throws you for a loop. And what we mean by throws you for a loop means your decisional capacity might be temporarily distorted. People who see doctors often take medications, and the medications can affect your cognitive ability. So that's a reason doctors have to pay attention. And disease affects cognition. So there are a lot of things going on in the doctor-patient relationship that can affect the patient's mental competence, and the doctor has to be acutely aware of that, show respect, and at the same time assess what's needed. So the gentle thing is saying things again, but if you think the patient hasn't understood or cannot understand, the doctor may have to suggest, well, why don't you come and see me again next week and bring somebody with you, bring your son or bring your spouse, and we'll talk about this again. So it can involve navigating complicated relationships while you're dealing with these conflicting responsibilities.
Absolutely. And what are some of the specific ways that a medical professional can change in the way that they relate to their patients?
I think an important thing is recognizing what these core responsibilities of the doctor are: showing respect, being non-judgmental. So in ordinary life, you can look at people who haven't gotten their vaccine and think they're shirking their responsibility or they're idiots. Whatever you think, you're allowed to think it. The doctor has to be non-judgmental and cannot show those feelings even when you're frustrated or angry or scared. You can imagine, I don't know, you're young, but there was Tony Soprano on TV. So the mobster. You can imagine that his doctors were very frightened when they're taking care of him. If you say the wrong word, he can blow your head off or send somebody to blow your head off. But if Tony Soprano needs medical care, they have to treat him with caring and respect, even when they're fearful. So that control over your feelings. In ordinary life, we value people who are genuine, real. And the doctor has to be especially thoughtful about what they're conveying to the patient. You can imagine a doctor on a floor with the patients, and the doctor goes into one room with a patient who's had a hospital stay now, doing really well, and they're going home and there's joy and they're sharing the joy and take good care of yourself and I'll see you in a month, and then goes into the next room where he has to share very bad news with the patient and commiserate. And that turning on a dime is a skill that doctors have to develop, and it's not something ordinary people do. And just the communication skills of a doctor are really challenging. So there's all the intellectual understanding, the diagnosis, the prognosis, what these different studies mean, how to do the exam, whatever they're doing. It's all, in fact, mental work, but there's also the interpersonal part. And the interpersonal part is key to maintaining and developing trust.
Absolutely. And you were talking about vaccines earlier, and my next question is about the pandemic, which we're all living through currently. And how has the pandemic helped or hurt the trust level between providers and patients?
Well, in the hospital, so I'm working now at Mount Sinai, and in our Mount Sinai hospitals during the peak of the pandemic in New York, so that was last spring, April, May, we had over 2,000 patients at a time. And you go from standard care to contingency levels, means you have one nurse taking care of more patients than usual. doctors taking care of many more patients than usual. All the facilities are crowded. You're moving to overflow facilities where you're not familiar with the environment. You're working with people who are not familiar with the environment they're working in. So you can think of the orthopedic resident. And now they have to come and take care of COVID patients with intubation. If you're an orthopedic resident, you're used to fixing broken bones, not to dealing with people who are having trouble breathing. So it's people feeling insecure in their environment and all these contingency arrangements. And I think one thing that we learned is how remarkably flexible the medical system can be and how prepared they were to manage all these crises. So from my perspective, it was an opportunity to see how heroic my colleagues are and can be.
Absolutely. Have there been any breakthroughs or scientific research that has improved better medical ethics in recent years that you've noticed?
There are always new issues in medical ethics. I don't know if that's what you're asking. So every scientific advance is accompanied by the ethical issues it raises. Every scientific advance can be used well or it can be used badly. And as soon as you're asking what's the right thing to do, you're entering medical ethics or ethics. And recent issues, most recently I've gotten involved in artificial intelligence issues. So you go to the dermatologist, they look at your skin, and the doctor says, come back in a year, and that mole on your back hasn't grown. So you're relying on the doctor's little drawing on the chart and maybe a measurement. But what we can do now is have machines take a lot of pictures of you and calibrate them. And the machine, when they take pictures of you again next year, they can tell the doctor if it's changed or if it's the same. Now, that's the software and the machine and the machine. And who makes the software or the machine? People do. So the things that the experts teach the machine are only as good as the person who's teaching the machine. And sometimes they think they're terrific, but they're not. And even people who think they're terrific and have expertise and experience mistakes. And the point of this artificial intelligence is cutting down on errors. What systems do we have to have in place to assess whether this software and the hardware is doing this well? And when you allow a big hospital system like Mount Sinai says, you can use the system, what kind of oversight do we have to vet the software and the hardware, to teach people how to use it, and to figure out if they're using it well? And a lot of these artificial intelligence systems, some of them are locked. So whatever it does today, it'll do the same thing tomorrow and the next day and the next day and the next day. But one advantage of this artificial intelligence is we say it can learn. It can get better and better at recognizing the pattern. Well, if the pattern and its recognition are getting better and better, that's terrific. But how do you know that it's gone in a good direction or a bad direction? So you have to be able to test it again. And how do you know that you're testing it again is good? So these are all issues for medical ethics today. Other issues have to do with genetics. And you asked about COVID and genetics. And at our hospital, we were pushing research with convalescent plasma. And there were questions about hydroxychloroquine and there's development of new tests and new vaccines. And an important question that came up during COVID is, you have this disease that's brand new. Nobody knew what would be an effective treatment. Nobody knew how it went. And somebody gets a great idea, hydroxychloroquine, inject bleach. So should you go ahead and try hydroxychloroquine or inject bleach because we have no other treatment? Or should you enroll patients in clinical research to find out if this works? Now, doctors are taught, act for the patient's best interest. So that means the patient, Leon, if you're my patient, I'm supposed to do what's best for you. And somebody said hydroxychloroquine. So I don't know if it'll be good for you or bad for you or do nothing. Should I just give you the hydroxychloroquine, or should I enroll you in a study where you might get the hydroxychloroquine or the placebo? So that was and continues to be a big question. So in the United States, we just gave people hydroxychloroquine. All these doctors got in their heads, you have to act in the best interest of the patient in front of you. And they just feel compelled to do something, even though they don't know if it's beneficial or harmful or does nothing. In England, they have a national health system and they pushed for research. So we were investing hundreds of millions of dollars in giving patients hydroxychloroquine. And this is a drug for people with lupus and malaria. And people with lupus experienced drug shortages. They couldn't get it. So you harmed other people. And we spent a lot of money and a lot of time and effort. And the British, who enrolled people in research, where some people got it and some people got placebo, they found out very quickly hydroxychloroquine does not work. So with that kind of issue, you have to think about, should you pursue research starting with patient number one, or should you try it out on patients, with each patient actually being like a test subject? So these are important questions that came up during COVID, during the pandemic, but these are bread and butter issues in medical ethics, an issue that comes up now. And so there are chat lines for bioethicists, and people are asking a question that to me is a crazy question. Patients come in, and some of them have been vaccinated, and some are not. They all need ventilators. Should you treat them equally, or should you prefer the patient who's had the vaccine? And if doctor, nurse are really annoyed with the patient who didn't get the vaccine, are they allowed to say, I'm not taking care of you? Now, I think an important principle of medical ethics, which you don't find in the standard list of 4, but an important principle is non-judgmental regard, which means if you're feeling annoyed at a patient, forget about it. You just get over it and treat them with caring and respect, even if they haven't had their vaccine, even if they say Trump won the election, whatever it is, it's your patient. Your responsibility is treating them with care and respect and to be non-judgmental. But these are issues that are going around right now.
My final question for you is, finally, how does a provider's adherence to good ethics directly affect the patient?
In every encounter and everything you do. As soon as the doctor says to a patient, how can I help you? Or just if they walk into the room and just start looking at numbers and not looking at the patient, that will affect the patient. So the doctor paying attention to ethics is required every minute of every day, with every word they say. You can imagine somebody getting the bad news. There are lots of ways of saying it to the patient, but the doctor has to think carefully about how to say and what to say and why they're saying it. And if the doctor's even going to say, this is now a fatal condition and I have nothing else to offer you in terms of medicine, they can still say, but I will be with you every step of the way. I will make sure you're not in pain. We will talk. I will be responsive when you have a problem. So it's ethics and professionalism every step of the way, in every word, in every decision. You have to think about what will help my patient.
Absolutely. Dr. Rhodes, I wanted to thank you for taking the time out of your busy schedule to meet with us from the Power of the Patient project, and we wish you the best of luck